What if you're trying to heal your sciatica and you're getting it all wrong? You're trying your physio, your osteo, your chiro, you got your injections lined up, but maybe we're putting it all together in the wrong kind of way. Well, in today's episode of the podcast, we're going to hopefully help you guys understand the right way to be looking at sciatica so that you can formulate a strategy to actually get results rather than bounce around from pillar to post, seeing one professional after the next expert, getting maybe some short-term relief at best, but it coming back time and time again. If you're new here, welcome. I'm Michael Fatiga, the lead osteopath and spine specialist here at Back in Shape. We help people around the UK and all over the world fix their back pain from home and get back in shape for the long term. And sciatica is one of the common conditions that many of our members and patients join us trying to get relief from. And hopefully, by looking at it in a different way, we'll have a solid approach to fix it once and for all. Right out the gate, the fundamental issue with sciatica is that we're often trying to fix our sciatica. And the sciatica is not the problem, it is a problem. But just like, for example, this disc that is bulging or herniated is hitting the sciatica, giving us that terrible pain, we go to see the specialist asking to relieve our sciatica. But the problem is actually the injury to our spine. And that is the thing that we need to fix. And as a consequence, our sciatica will get better. But too many people make this implicit misunderstanding and they're seeking out things to alleviate the pain, which often run counter to actually fixing the problem. Our expectations are also an issue. The idea that a 5-minute intervention, maybe with a needle, a 15-minute adjustment, or a 50-minute acupuncture or osteopathy session is going to fix 168 hours worth of bad stuff for that week alone is really quite silly when we say it out loud. And our expectations often are completely wrong. The expectations that we pin on some of these professionals, experts and specialists, and quite equally, in many cases, the expectations that they are giving us are also equally wrong. We're not talking at all about a fundamental baseline that needs to be in there in your recovery strategy. On the positive side, one of the important realizations we need to have is that disc bulge perhaps, or herniation or facet injury at the root cause of your sciatica is trying to heal every single day. But the tissues, the ligamentous type tissues that are in that region have both a very poor blood supply and are very slow in terms of their metabolic activity, meaning that healing process is taking place at a very, very steady rate. Especially when we compare it to the healing process that might be taking place on a cut on the surface of our skin. When we understand this, that our body is trying to get better, we then start to think about, well, what's stopping that? And the big thing is these little things that we're doing that are picking the scab every single day, meaning that our back is injured, and then it goes through a recovery process, and then we do silly things during the day that constantly aggravate and pick the scab. And because it's not like the surface of our skin, each time we aggravate it that little bit more, it creates that inflammation, that flare-up of sciatica down the leg, and things get a little bit worse, which is why often people will notice that their sciatica perhaps even started out as some back pain that gradually get worse and worse, and the episodes were lasting longer and longer, and they weren't getting better from them, and then it was sciatica, and then it was worse sciatica, and now it's really bad sciatica. Because each time we continually re-aggravate the tissues that are trying to heal automatically, we knock it back another step and another step further. And the real difficulty with back pain is often you don't know what you don't know, and you don't know that these little things are there. It's only when you have a conversation with patients time and time again, and they say, yeah, my back pain, it keeps on getting bad for no reason. My flare-up's there for no reason, from one day to the next, 1 week to the next. I can't really pinpoint anything. And that's because the activities of your daily life are continually being done in a way that strains those tissues that are trying to get better. Just like in a very, very obvious example, the lady that's just had a C-section has been stitched up. If she goes home that same day and starts doing sit-ups and carrying the baby, it's no wonder that the healing's not going to take place. And no matter what one of those procedures that we touched on at the start of this episode, or the ones that you might have had, injections, whatever, osteopathy treatment, chiropractic adjustments, even microdiscectomy type surgeries, you have to understand that those things don't heal you. You're still injured after you have those sessions, and you can still go home and make things worse, like pulling out the stitches in the C-section example. And fundamentally, because unlike other injuries like the knee, the hip, the ankle, the wrist, the shoulder, we can't take our spine out and put in a new one while ours is healing. We have to have this education process alongside our rehabilitation, our treatment interventions, etc., in order to make sure that in that 167.5 hours outside of the 30-minute appointment we had with the expert each week, we are not inadvertently making our sciatica worse. So as if it wasn't already obvious, without the proper education outside of the clinical environment or the hospital environment, you're not going to get better with sciatica, because too much is riding on how you use your body outside of the appointment. And so education is that vital process. That's why, for example, in the program, of the hundreds of videos, probably around 60%, if not a little bit more, is educational, helping you guys understand how we should be doing certain things, understanding how the spine works, understanding how it fails. This is vital alongside the doing that is done at home or the treatments that we might have. And to that end, we need to be doing proper spine stability work so that once we leave whatever treatment we might have, if we are even going to do that, we are not going home doing silly little things and aggravating things. That's why the spine stability exercises that we covered in a recent podcast, the Core 5 for Spine Health, are such a great list of exercises. And they're chosen specifically, and you can find out more on why those specific exercises were chosen. We've got the dead bug, marching bridge, the squat, the hip hinge, and the step up. But specifically things like the squat and the hip hinge and the step up, three which often strike fear into the heart of someone with sciatica. You are doing those movements every single day. You will do them after you've seen the surgeon, after you've seen the osteopath, after you've seen the chiropractor, after you've seen the physio, on your way home and around the house on a daily basis. And so without improving the competence of those things, all of those treatments that might be great in what they can offer you will continually be undermined. We have to make sure we are doing this rehab work as part of a complete strategy. And the rehab work comes first, as we'll get onto later. May be forgiven for wondering, well, why on earth haven't you spoken about treatment yet? And the reason for that is that 90% of the work, the benefit, the recovery that you're going to get from your sciatica comes from the education and the rehab work at home. That's where you literally change your body. The interface that someone else has, maybe it's a massage, maybe it's an adjustment, maybe it's osteopathy, maybe it's an injection, maybe it's a microdiscectomy to take a bit of that disc away. Those are small interventions which you can then go home and re-aggravate. The amount of times we get people, for example, commenting on our social channels saying, well, I had a discectomy 6 months ago and now I've got an L4-5 disc bulge instead of an L5-S1, or the disc bulged on the other side. And this again goes back to that expectation, the false expectation of that treatment, and the absence of awareness that actually the pyramid that makes up our back rehab, our recovery from our sciatica, needs to be 90% done by us at home every single day, because there are so many of those hours at home that we are left to our own devices. Now, if you've started making significant work on the rehab front, then sure, leveraging specific treatments to offer you support, targeted intervention can be an absolutely fantastic supplement to the sustenance that we get from our rehab, to view it as a food analogy. It's no good trying to survive on vitamin D supplements and zinc pills and try and have good health if we're not actually eating the food first. We need to focus, for example, on getting a good diet, getting the raw materials that our body needs, the protein, the carbohydrates, and the fats on board on a daily basis. And then that little extra bit is going to be maybe through some supplementation and some additional resources. And just like with our recovery from sciatica, the baseline is the stuff that affects us every single day. It's the learning to move correctly. It's the greater conscientiousness about how we use our body on a daily basis, especially in those early days, to make sure that we're not tripping ourselves up every single day, aggravating this disc and preventing a complete and continued recovery from occurring and healing in that disc. And then we supplement that with an intervention from the specialist, from the osteopath, chiropractor, the acupuncture session, etc. And this is why our viewpoint over the years has changed in terms of the role of treatment. Because as a osteopath, you are taught, as a chiropractor, I'm sure it's the same, and as a physiotherapist, you're the same. You're trying to intervene and help the patient. The surgeon is trying their best to help the patient. But actually what we've seen is that with patients that come here now, you've got to do the rehab work before you come in and have a great IDD session on the table down there, or we do some laser to help you. You have to do that, because it's no good if you get off that IDD spinal decompression machine. And there's a full podcast on IDD therapy for those of you that don't know what that's about and how that helps things like sciatica and herniated discs. But it's no good you get off that table. We've done some great work to decompress that section of the spine. We've done the laser to calm down inflammation. If you then get up, round your lower back to pick your bag up at the end, if you even thought to put your bag on the floor, or often didn't think to put your bag on the floor, the way in which we get in the car afterwards, these little things need to be fixed first before we go and have a treatment that can help us, only to unfortunately undermine what we're doing by the way in which we conduct ourselves after the treatment. These little things sound silly, But the simple truth is that cases of sciatica and back pain are not often caused or triggered by a tremendous action. It's the little things, getting them wrong time and time again, to the point where picking up our sock or putting it on in the morning or getting our underwear on is the thing that caused the most recent episode. That's a clear identifier of poor back health. A healthy spine does not get injured in that way. And so understanding that those sorts of features of your daily life, the way in which you move and use yourself, need to be addressed, because they are the things that have really, at the truest cause, caused the injury that caused your sciatica. Unfortunately, too often when you're struggling in agony with the sciatic symptoms down your leg, the discussion of what you're doing the last 168 hours of the week isn't had and how we could do it better. And it's all too tempting to reach for the next painkiller, the next procedure, pin our hopes on someone, a knight in shining armor, coming along and taking away all the pain. That doesn't happen. And if it does happen, it doesn't last for long and it often comes back. But if we take a step back and start to put in place the foundations, the right rehab work, the right education work to understand the problem, you wouldn't be watching the video this far if you weren't trying to improve your understanding of what's going on in your own body. And that's a great start. We've got tons of other videos on the YouTube channel, resources on the website to help you guys get a better understanding of sciatica and appreciate that you need to, and want to hopefully, take accountability for how you use that other 167, let's say, hours of the week to be an asset to your recovery, to support the healing that's trying to take place in that lumbar spine, so that you can leverage certain additional therapies, if warranted, for much more beneficial effect. And if you do that in the right way, you're going to find you can, if you want to, leverage some of these other treatments alongside the good work that you're doing at home, rather than having the rehab work a sheet of paper that's an afterthought at the end of a session that really isn't given the credibility and the emphasis that it deserves. Yes, it's hard work, but it is the work that gives us the lasting results and relief from sciatica that we are looking for. Hopefully you found this video helpful. Hopefully it's made you think about things in a bit of a different way. If you know someone else that's struggling with their sciatica, consider sharing this video with them. Hopefully it'll give them a fresh perspective and maybe a little bit of hope that they too can start to recover again, as we've seen countless people coming through the membership or coming through the clinic do. Thanks for watching, and we'll see you in the next one.